Welcome to the USC Neurology Department. This orientation will give you an overview of the neurology services provided at USC, as well as basic information about the neuroscience nursing department. The neurology department consists of the neurocritical care team and the neurology floor consult team. The neurocritical care team includes one resident, one fellow, one nurse practitioner, and the attending on any given day. The neurocritical care team follows all neuro-ICU patients, step-down patients, and is the critical care team assigned to all neurosurgery post-ops. The neurocritical care team is also responsible for responding to any code stroke activation. The neurology floor and consult service is comprised of two residents, one nurse practitioner Monday through Thursday, and one attending on any given day. The neurocritical care team provides night coverage from 6 p.m. to 6 a.m. for the entire neurology service. Both services require a pager and a VoIP, as well as an additional consult pager. While rotating in the neurocritical care unit, it is expected that you are in the 7 South ICU by 6 a.m. to receive handoff from the night shift provider. Afterwards, the fellow NP and resident will huddle to determine patient assignments. The team then pre-rounds on all patients, completes their notes, and runs the list with neurosurgery. Between 7 and 7:30, the nurses change shift. At 8 a.m., multidisciplinary rounds take place with the case manager, social work, rehab services, and the charge nurse. By 8:15, the attending will start radiology rounds, and by 9 a.m., the attending will begin neuro-ICU rounds. By noon, the team is usually able to break for lunch. Between 1 and 4 p.m., the team is checking orders, following up on any labs or diagnostics, performing procedures, consulting other disciplines, and/or providing family updates. Between 3 and 4 p.m., the team will generally run the list with neurosurgery again to address any updates. At 5 p.m., the team meets with the attending for evening rounds. At 6 p.m., the team will hand off report to the night provider. At 7 p.m., the nurses change shifts, and it can be helpful to round with the leads to clarify the plan of care for each patient. Finally, between 8 and 9 p.m., the night provider will go huddle with the floor nurses. While rounding in the neuro-ICU, please adhere to the rounding script while presenting patients as outlined in the chart. While one person is presenting, the rest of the team will be tasked with inputting orders, updating handoff, or reading back the plan of care to ensure closed-loop communication. The bedside nurses are also present while rounding on each patient and are responsible for addressing the ABCDEF bundle and can have questions and concerns addressed in real time. During this time, you may also be confronted with emergencies, admissions, and urgent procedures. In this case, a member of the team will be required to break off while the rest of the team continues rounding. The ABCDEF bundle is a nurse rounding tool that is utilized during rounds with the attending physician to ensure a complete and comprehensive report from the nursing staff, as well as address any pertinent issues such as pain, ventilator weaning, sedation, delirium, catheters, lines, mobility, diet, and family support. The stroke quality measures are completed on all strokes and hemorrhages unless they are traumatic. It is used to monitor whether certain guidelines are being met and must be documented on by the team to demonstrate when measures are completed and avoid fallouts. IPASS is a tool you will be utilizing when handing off report to another team member. I is for illness severity. Is the patient stable? Are we watching closely, or are they unstable? P is for patient summary. Summarize the patient's pertinent history, reason for admission, hospital course, and ongoing assessment and plan. A is for action list. What are the to-dos for this patient? What is our timeline? S is for situation awareness and contingency planning. What is going on and what plans have we set in place in case of emergency? S is for synthesis by receiver. The receiver should be able to repeat back the information and verbalize understanding. This is also a good time to ask questions or voice any concerns. The majority of the patient population are transfers from outside hospitals and neurosurgery post-ops. It is important that you understand your role and responsibilities to ensure a smooth admission process, avoid post-op complications, and are able to expedite the plan of care. Anytime a patient is transferring into or out of the ICU, handoff should occur between attendings, NPs and residents, and the nursing staff. Patients arriving from outside hospitals will arrive through ETC, and you may call this unit to receive updates on the patient's arrival. Patients arriving in the ICU immediately post-op under neurosurgery demand the presence of an NCC team member at bedside to receive a report from anesthesia and neurosurgery. We are their ICU team, so it is your job to be prepared and take responsibility for these patients. Once patients are deemed medically stable for transfer to ARU, LTAC, or SNF, it is the responsibility of the resident to inform the patient and family of transfer. fill out the interfacility transfer form including signature for consent, complete the medication reconciliation form, ensure appropriate transportation has been arranged, and place the discharge order. If the patient is fortunate enough to discharge directly to home, it is imperative that the patient and family receive education and resources and instructions on follow-up appointments, as well as have any prescriptions electronically sent to their preferred pharmacy prior to discharge. Please note the sections of the interfacility transfer form that you will be required to complete. The physician report and physician certification must be filled out with the physician's signature, date, and time noted. Once you obtain consent from the patient or family for transfer, the nurse will then have the patient or family member sign the authorization and consent for transfer section. While rotating with the neurology floor team, one resident will be expected to be in 7 South ICU at 6 a.m. to receive handoff from the night provider after NCC has received sign-out. Afterwards, the NP and resident or residents will huddle to determine patient assignments. The team will then chart review and pre-round on patients and begin their notes. At 8:15, the team participates in multidisciplinary rounds with the case manager, social work, and rehab services. At 8:30, the case manager will update the 7 North charge nurse. By 9 a.m., radiology rounds will begin with the attending, and by 9:15, the team is rounding on the floor with the attending. Around 12 p.m., the team will take lunch. Between 1 and 4 p.m., the team checks orders, follows up on any labs and diagnostics, sees new consults, and provides family updates. By 6 p.m., a member of the floor team should be in the 7 South ICU ready to give report to the night provider after NCC has finished sign-up. While rounding on the floor, please adhere to the rounding script while presenting patients as outlined in the chart. Unlike the ICU, the presenter will discuss the plan of care with the attending at the nurse's station in the 7 South ICU. During this time, another member of the team can place pertinent orders, while other orders may wait until after rounds are complete. After discussing each patient, the team will then physically round on each patient at bedside to complete the physical exam and provide updates, touch base with the nursing staff, and address any questions or concerns from the patient. The floor team also operates as the neurology consult team and will be expected to respond to consults in a respectful and timely manner. Unless it is an emergency, most consults can be seen after rounding on the team's primary service. As residents, you are expected to see any and all consults as part of your learning experience. The NP will be focused on managing the primary floor patients and generally will only see consults when covering for the residents or when the rest of the team members are already seeing patients. Patient transfers into and out of the floor are carried out in a similar fashion compared to the ICU. Please feel free to review these slides at your leisure for more detail. Since visitation from families and loved ones has been restricted and the policies surrounding visitation are constantly changing due to COVID-19, we have been diligent about having a team member communicate daily with a designated decision maker in order to provide consistent updates and answer any questions or concerns patients' families may have. This can be done over the phone, in person, or over FaceTime or Zoom. Generally, these conversations occur in the afternoon since the team is occupied with rounds in the morning. Of note, if there are any disagreements amongst family members regarding who should be updated or making medical decisions on behalf of the patient, please enlist the social worker for assistance. Stroke code is activated by the rapid response team or the primary team provider only. The NCC team responds to the code, which is currently live at KEC for inpatients and ETC, as well as at Norris. One member from NCC or the entire team must respond immediately along with a 7 South RN, pharmacy, and usually the nursing or house supervisor. The code will also prompt security to clear the elevators and ensure the CT scanner is available for rapid stroke imaging. Please ensure a member of the primary team is present to obtain an accurate history and report. If the patient is deemed a candidate for TPA or thrombectomy or requires neuro ICU monitoring, the NCC team will continue to follow. If the patient is not a candidate for TPA or thrombectomy, then the patient will be signed out to the neuro consult team. The neurocritical care team responds to any and all rapid responses or code blue scenarios involving neurology patients. The neurology floor service is only required to respond to a rapid response or code blue if they are currently following that patient on the floor. If a code blue is called on a neuro patient and NCC arrives prior to the code team, you should be prepared to run the code and be responsible for that patient. Please review the table on documentation to ensure you are utilizing the correct templates and framework when writing notes. While rotating with neurocritical care, residents are required to examine 4 patients and write up to 4 notes prior to rounds. Please know your patients well and be prepared to present them to your attending each morning. You are also required to make sure the nurse is updated on the plan of care at bedside. In the afternoon, you will be expected to check or update orders, provide family updates, discuss goals of care, admit new patients, prepare discharges, perform any necessary bedside procedures, and consult interdisciplinary teams. The NPs carry all the same responsibilities as the residents, but can write up to 7 notes per day and are well versed on the entire ICU patient roster. Of note, residents should be focused on following the primary neurocritical care patients, while the NP and fellows will see the neurosurgery postoperative consults. POLST stands for Physician Orders for Life-Sustaining Treatment. You will come across this form in practice and should know how to fill one out. POLST are completed and signed by the patient's healthcare provider and inform other providers of the patient's wishes in regards to code status, extent of medical interventions, nutrition, and who will make decisions for the patient when they lack capacity. This form is very useful when patients are discharging or transferring to another facility, especially if the patient's code status has changed during their hospital admission. Please familiarize yourself with the death certificate form, as you will be expected to fill in the information to the best of your ability in the event that your patient expires. You will likely have questions the first time completing this form, so please don't hesitate to ask the NPs or attendings any questions you may have, especially since the attending ultimately must approve the worksheet and sign it. It is important to note that oftentimes you'll fill out this form for a brain dead patient. When a patient is declared brain dead, that should be the time of death you note on their certificate, not the subsequent cardiac death upon extubation. In order to ensure easy access to completed death certificates, please download the Cerner Capture application to upload a photo of the death certificate form to the electronic medical record. One of the most common questions you will all have is, when do I call my attending? You may call your attending for the following reasons: procedures, new admissions you need to staff, new consults you need to staff, any acute change in your patient's condition or decompensation, if there are difficult families, patients, or situations that result in risk management being involved, instances that they have told you to contact them, if you're not feeling well, if you just need help, and of course, if you're not sure, just call. Also, don't forget, if you're in the neuro ICU, the fellow is a great resource, and do not forget to talk to them before calling your attending. There are several clinical trials that we are actively enrolling at any given time. Here are some listed below. We encourage you to become familiar with our clinical trials and know the criteria for enrollment so you are able to notify the team of any possible candidates. Meet the neurology medical staff. You will be working closely with all of the faculty throughout your time here. The neurocritical care attendings include Dr. May Kim Tenser, Dr. Sabina Bulich, Dr. Peggy Nguyen, and Dr. Benjamin Emanuel. The neurology floor attending Dr. Johannes Puls-Korenberg. The neurocritical care nurse practitioners include Caroline Crane and Elmer Dorison. The floor nurse practitioner is Peony Bragg. You'll also be working closely with the fellows. Meet our 7 South neurocritical care neurology nurses. They are all amazing and stellar. Please get to know them. Please build good rapport with them. They are your eyes and ears, and you would never get through the day without them. Meet the 7 North neurology floor nurses. This is also an amazing team. They're a great resource. Please get to know them, build rapport with them, and especially build rapport with your night shift nurses. It's really going to help you on your rotation.